Hola, buenos días, buenas tardes.
Hello, good morning and good afternoon, everybody. Welcome to the press briefing of the Pan American Health Organization, PAHO. Today is Wednesday, June 1st, 2022. My name is Luciana Viegas, Public Affairs Advisor at PAHO. We have interpretation in French, English, Spanish, and Portuguese. You can access it to the interpretation button. Thank you to the journalists who sent us questions in advance, but you will be able to ask questions during this session on the Q&A button. Please give your name and your outlet when you send your question. Today, we begin with the words by Dr. Carissa Etienne, Director of PAHO, who will give an update of the situation of COVID-19 in the region, and she will also cover other health matters. Dr. Marcos Espinal, Interim Assistant Director of PAHO, Dr. Ciro Ugarte, Director, Department of Health Emergencies and PAHO, and Dr. Andrea Vicari, Head of the Unit of Infectious Threat Unit of PAHO as well. Now, over to you, Madam Director, and then we'll have questions.
Thank you very much, and good morning. And thank you for joining me for today's press briefing. COVID-19 cases and deaths have continued to rise across our region. Last week, there were 1,087,390 cases and 4,155 deaths reported in the Americas. This represents a 10.4% increase in the number of cases and a 14% increase in deaths. At the sub-regional level, all sub-regions except the Caribbean and Atlantic Ocean islands have seen increases both in cases and deaths. The highest increase in cases was in South America, with a 43.1% increase, and the highest increase in deaths was in Central America, with a 21.3% rise. Cases in the region have been increasing for the past 6 weeks. Now, as the summer holiday season approaches in the Northern Hemisphere and the winter season starts in the Southern Hemisphere, we must continue to be vigilant. We have the tools to prevent the worst consequences of this virus. As cases rise and hospitals get busy, now is the time to use these tools. Our toolkit includes masks and public health measures to slow down the spread of the virus and vaccines to avoid severe diseases and deaths. Our health systems are still recovering from the disruptions brought by the pandemic, but they are now facing another surge of COVID-19 cases, coupled with a growing risk of current public health events, including monkeypox, viral hepatitis, and other respiratory infections. Since the introduction of SARS-CoV-2, influenza cases have been exceptionally low in the region. But this situation started to change in 2022. The flu virus is circulating again, and not just during traditional flu season. Mexico and Peru have seen higher numbers of influenza cases than expected. And Argentina, Chile, and Uruguay have reported more hospitalizations than usual due to influenza. Chile, Paraguay, Brazil, Ecuador, and the Dominican Republic are also experiencing surges of the RSV virus in young children, in some cases leading to hospitalization. Just as we have responded to COVID, we must use all the resources that we have at hand, starting with vaccines. The current flu vaccine used in the Southern Hemisphere reflects the strains circulating now and can provide better protection to all at risk. Brazil and Ecuador kicked off their influenza vaccination campaigns during the vaccination week in the Americas. At least 15 other countries are launching campaigns to reach the elderly, pregnant people, children, and other vulnerable groups. These campaigns are important every year, but even more importantly this year, as we are facing multiple risks at the same time. Countries should expand surveillance to monitor other respiratory viruses, not just COVID. Most countries have integrated COVID-19 surveillance with efforts to track the influenza virus. We should build on that capacity to quickly identify the different respiratory viruses that are circulating in the Americas. It is important to note that the same public health measures that protect people from COVID-19 also protect people from the flu. But this recent surge represents a risk for our health systems, and we should track hospital capacity closely. Many places are facing the double threat of a potential influenza surge alongside a rise in COVID-19 cases, which will put healthcare workers, the elderly, and pregnant women at additional risk. Some countries are facing a triple threat with the addition of an RSV wave in children. We have the expertise to treat people affected by these viruses, but countries must adjust their capacity and direct enough resources and staff to help our health systems put this knowledge to use and save more lives. This brings me to another point of pressure for health services in the Americas, especially in Central America and the Caribbean. Hurricane season is once again upon us. Climate change has led to an undeniable rise in the frequency and impact of extreme weather events such as hurricanes, unusually heavy rains, and floods in many parts of our region. And while we must do all in our power to slow climate change, we also have to prepare to face the immediate consequences of extreme weather events. The United States National Oceanic and Atmospheric Administration and the Central America Integration System expect to see more storms than average this year, especially in the Atlantic, the Gulf of Mexico, and the Caribbean. This is concerning as it only takes one massive storm to destroy people's livelihoods, cripple our health systems, and lead to countless lives lost. We must prepare early so we are not caught off guard. Many countries already have national plans for extreme weather events. It is time now to revisit these strategies to make sure that they are up to date and to put plans into action. Countries should have a detailed understanding of their risk areas and the likely populations and health facilities which could be affected. PAHO has met with countries to assess risks, to review plans, and to help address vulnerabilities ahead of time. Long-term investments were also made with the support of PAHO's Smart Hospitals program, supporting renovations of health centers in areas that are vulnerable to natural disasters so that they could better withstand crisis events. This approach has been applied across the region and has helped, for instance, the Chateau Bel Air Hospital in St. Vincent and the Grenadines, where they were able to withstand a volcanic eruption, the COVID-19 pandemic, and a hurricane. Whether it is COVID-19, hurricanes, or seasonal respiratory viruses, we must rely on the same health systems to respond and recover. At a time of crisis, our well-being and that of our societies depend on the resilience of our health systems. And that is an important lesson from COVID-19 that we cannot ignore. Heads of state at the 9th Summit of the Americas in Los Angeles from June 8th to 10th will commit towards building a sustainable, resilient, and equitable future, which includes resilience in health and the economies. We must plan and invest now to deal with the risks of today and better prepare for the challenges of tomorrow. An investment in health is essential to secure everything that we hope for the future of our region: resilience and security, economic prosperity, and the well-being of our people. Over.
Thank you very much, Director. Pasamos entonces a las preguntas que
Now
recibimos.
we go to the questions we have received by email. First, we'll begin with monkeypox. We have 3 questions from Elena Pocar from Diario El Comercio in Ecuador. The more general question first, and it will be for the director now to English here.
Director, for you, the question from Elena Pocar from El Comercio. She asks, what are the results of studies by WHO on the possible causes of the recent cases of monkeypox with no epidemiological link with infections in countries where the disease is endemic? Director, please.
So thank you for this question. The sudden appearance of monkeypox in several non-endemic countries over a period of few weeks is of itself unusual. Public health experts are beginning to get a handle on how monkeypox is spreading in this latest outbreak. Nonetheless, this outbreak deserves attention. Public health investigations are ongoing in countries that have identified cases, including case finding, the isolation and treatment of patients, and tracing and monitoring of contacts. Countries are ramping up surveillance, so we can expect that the number of cases and affected countries will increase. But from what we know about this virus and its transmission, the outbreak should be containable. Swift action must be taken, however, before the virus can be allowed to establish itself in non-endemic areas. So in response, I have activated PAHO's special emergency procedures to help member states. We are supporting the countries of the Americas in laboratory testing, surveillance, case investigation, clinical management, and infection prevention and control. We are also evaluating the use and availability of vaccines. We are providing public information to health ministries, health workers, and to the population at large on how to keep safe. We are also engaging with communities to develop targeted messages for groups who are most at risk. And as a final point, let me say that, and let me stress that the risk to the general public remains low at this time, but we must be vigilant. Thank you again for this question.
Thank you very much, Director. Pasamos a una otra pregunta.
Now we have another question, follow-up from the same journalist about tests. And so her question is, how is PAHO supporting countries with access to reagents and tests, PCR tests for diagnosis the disease of the monkeypox? Dr. Vicari, to you. Thank you very much for your question. I would like to mention a few of the points that Dr. Etienne has mentioned to this point. We do have, if we act quickly, we will be able to contain transmission as well. And I think this is a very important message in this sense. And also, in this sense, Dr. Etienne talked about the importance of surveillance and how surveillance in terms of detecting cases and also doing a tracing of contacts. And the question mentions the PCR tests or molecular tests, which are the ones that are required to do good surveillance and then being able to focus on contact tracing. For several years, PAHO has been working with the countries and with the country laboratories. We have very strong networks. with the virology laboratories that we have mentioned here for influenza, and we have seen it also with COVID-19. And in this situation, we don't do more than what we had done before. Ultimately, provide the countries with the ability to make a diagnosis within the country of this new virus, a new virus that has not been seen in the area before. The actions need to be very specific. That's what we provide. We develop protocols which the countries and laboratories can follow. And also we provide training to personnel. They already have the equipment, they have the base knowledge and also experience in that sense. So the training we provide is a quick training of specific protocols regarding testing of monkeypox virus. The other part, which will happen in the next few days, is to make available to laboratories the tests that are that the countries know how to do. However, we need key reagents, specifically probes and primers to do these kinds of tests, which we usually make available to the countries. So these specific reagents are being made in 2 labs in the region in Mexico and Brazil. And we thank these national laboratories for their support. And once the countries receive these critical reagents, we will be able to do quality control, which is very important to ensure not only diagnosis, but to make sure that the diagnosis is a quality one. Thank you. Thank you very much, Dr. Vicari. Another question from Elena. Elena, she wants to know what plans there are for purchasing vaccines against the monkeypox as a containment strategy and with a possible contacts. Dr. Espinal. Yes, thank you very much. As our director already noted, the management of this event has already been initiated, and we have a group working on different fronts. The organization works on different fronts, as Dr. Vicari mentioned. What's important first is diagnosis, confirming cases, because vaccinating is not just vaccinating everybody. No, this should be clear. But we should never create a panic. We have limited amounts of the vaccine. However, the organization had an emergency meeting of the TAG group on vaccines, and the recommendations are on their way, and also prioritization of public health workers who are in contact with the public and with the patients, and also lab staff that handles the virus. A plan is being prepared, which will be made available to all member states in a matter of days. And at the same time, we are in discussions with those who manufacture the vaccines, second generation and third generation vaccines. These are vaccines that are recommended, and they can be used for preventing monkeypox. But we should always focus on priority groups. PAHO is working on this plan, and the plan will be available to all countries, as I've said, and at the same time with our revolving fund for vaccines and the immunization unit of PAHO and all the incident management team, we're trying to work as quickly as possible. Thank you very much. Thank you, Dr. Espinal. Now, there's a first question regarding the situation of COVID-19. Marco Dueñas, Televisa Mexico says, is there a special, or is there a variant of special concern at this point in time? Dr. Vicari, please. Thank you very much for your question. Evidently, the variants of the virus causing COVID-19 has been an important issue in the last year and a half. And even though there is less transmission now, it continues to be a significant matter that countries continue to do their work and that the organization continues to support. We need to monitor continually. The virus differentiates itself, and it is expected. It's part of the evolution of the virus. So the work of the tag regarding the viral evolution, these groups of experts get together regularly, and they follow the data coming from the countries, and they analyze and to keep track of what's going on. The new lineages are still classified under Omicron. Omicron has been the variant that has been circulating since the year 2021. All of this, there is the BA.5 lineage. This one is under monitoring at present, and it is a variant of concern. And it is essentially part of our follow-up work. This work is being done currently. There has this new sublineage has been detected more in Africa, in South Africa, but also in other parts recently. The variant continues to be part of Omicron. It is the immunological escape, the ability of these new lineages to cause disease again in persons who have already had a prior infection or a recent infection due to Omicron. And it also has an impact on the protection offered by the vaccine. It is important to emphasize, especially regarding vaccine protection, that it is continuous to be important, and it is recommended that people continue to be vaccinated. If we have the full schedule, protects against severe diseases, so we still recommend to be vaccinated. So even though there is less transmission, we need to monitor, and we are monitoring the variants and follow the evolution of the variant, and then we will take the necessary measures together with all the countries. Thank you very much. Thank you, Dr. Vicari. One more question, which we received on the chat from Blanca Valadez, Mexico, about the variants. The BA.5 lineage is in Mexico, and will it bring about new waves of transmission? Will there be a fifth wave? Well, I will continue, therefore. I've already mentioned the fact that we're monitoring this new lineage, which is the BA.5, especially given the observations in South Africa and then also in the Iberian Peninsula, Portugal and Mexico. This is a sublineage that is being monitored. I would like to say that to this point, in the global repository of all sequences, we only have 3 sequences of BA.5 for Mexico. And this is to give you context. The United States have 531. So of course, we cannot truly talk about a wave in Mexico yet. Perhaps it'll never happen, but as all things that happen with this pandemic, the pandemic follows its course and it continues, and it's important to continue to monitor the different variants, how they are replaced and how they can cause disease. So it's important to continue to monitor, and But at this point in time, it shouldn't be cause for alarm or great alarm at any rate at this point. Thank you, Dr. Vicari. Now we have a question about vaccines, COVID vaccines. Daisy Viegas from El Universo in Ecuador. Daisy asks, what are the guidelines for the second booster of the vaccine, Dr. Espinal? Thank you very much. Well, first thing is a first booster. If you will need a second booster, the current recommendation by the group of experts of the World Health Organization is in very specific cases, specific groups of people requiring a second booster or a fourth dose. These include immunodepressed people, or people who have situations that will lower their defenses. Also, people older than 60 who may be exposed to challenging situations, for example, having comorbidities that may lead to immunodepression. If you are over 60 and you have a third booster, you can go and get a fourth booster, or excuse me, a second booster, a fourth dose. What's important is that it is not one single dose. We have the first dose, the second dose, then first booster, and then if the person is immunodepressed, you can have a second booster, and also depending on the situation in a given country. But basically, those are the guidelines for the second booster. Thank you.
Thank you, Dr. Espinal. We now have a question from Melina Ochoa from Uno TV. We received it via chat and email from Mexico. Melina asked, does PAHO see an increase in COVID cases in Mexico? When and how? What conditions could result in a fifth wave of coronavirus in the country? Dr. Ugarte, please. Thank you, Luciana, and thank you also, Melina. This is a question that obviously applies to Mexico as well as to so many other countries, as our director pointed out. Last week, we had over 1 million cases and over 4,000 deaths, the third consecutive week, and 12,000 new cases have gone up after the 5,200 cases that we had before. That's 75% increase from one week to the next. But these are relative increases. The number of cases compared to other weeks when there was high contagion during the pandemic, these figures are still manageable. Therefore, let me point out that the general use of hospital beds and intensive care units are still at 4% and 1% respectively. So given the increase in cases in Mexico, as well as the rest of the region, it is important to maintain preventive measures and public health measures. We see that when those measures are relaxed, that is when there are new opportunities for the disease. We can call them waves or an increase in number of cases. Sometimes these increases can be located in more populated cities. But as we have heard, this is also an increase in influenza. So the protective measures must be taken into consideration in contexts where Mexico and other countries suffer from hurricanes, and at times of crisis, people may be moving from one area to another. They might have to evacuate, or there are in shelters and are in closer contact with other people. So the measures have to be implemented. We have said this very often. Some of those measures may be or maybe seen by the population as exaggerated measures, but actually that's not true. That's not the case. Prevention, vaccination against the flu and COVID-19 are extremely important. We must continue increasing vaccination coverage. As Dr. Espinal pointed out, it has to be a complete regime. And those people who need boosters must get them. Vaccines are available. The countries are carrying out vaccinations. And if you want to be protected and want to protect your families, then be vaccinated and do so as soon as possible. Thank you. Thank you, Dr. Ugarte. We have a follow-up question on the monkeypox. It's from Jorge Dastis from EFE in Washington. Jorge asks, how does PAHO's experience with COVID response influence the kind of response given to the monkeypox? What similarities and differences are there between these two diseases when it comes to public health? Let me perhaps begin with Dr. Espinal. Thank you very much. Yes, there are similarities. The chief one is that experience gained managing COVID has been very valuable, and the organization has a tremendous amount of expertise. The organization has many under management by the manager of incidents or the group that is corporately representing the entire PAHO, advising countries, focusing on response preparation, etc. So as the director pointed out, there is already a manager who has been appointed and a team set up to manage monkeypox. There are also differences, however. COVID is transmitted by air. The pox is direct contacts. The risk for monkeypox is generally low because it's not a new disease. It's a disease that has existed in certain African countries where there are natural reservoirs. And today, what we have identified is a specific group. For instance, the group where it has been identified is men having sex with other men, but then there are also other groups. It's not just on a group. That's why we require additional data. What is clearly understood is that the difference between COVID and monkeypox is that the risk is much lower. Furthermore, massive vaccination is not recommended, as we did with COVID, but essentially it has to have to be given to healthcare professionals, laboratory, in the same way that COVID spread, causing great mortality. The difference is mortality. The mortality rate is very low, for instance, compared to COVID. There are things, however, that can be used, and the advice is to work with countries to implement the recommended plans. Thank you very much. Thank you very much, Dr. Espinal. We have a question from Jeffar Gibson.
Jafar asks, although there are no confirmed monkeypox cases in the Bahamas currently, what preparations should be taken for its inevitable presence? How concerned should member states be about this outbreak? Which I guess the director answered, but Dr. Ugarte, please, if you could say a few words.
Okay, thank you, Luciana. Thank you, Jefara, for this important question also, because from what we know about this virus and the modes of transmission, this outbreak is containable. It was repeated several times during this press briefing, and WHO has issued a specific guideline to help the countries to reduce or contain the spread. So rapid action must be taken before the virus can be allowed to establish itself in both endemic and non-endemic context. So lessons learned, for example, from the eradication of smallpox and from all. So countries should be on alert for signals related to patients presenting, for example, with a rash that progresses in sequential stages on macules, papules, vesicles, pustules, scabs, and for close looking at those at the same stage of development of all these progressing dermatology signals and symptoms, we'll see that many may be associated also with fever, enlarged lymph nodes, headache, back pain, muscle aches, or fatigue. So it is extremely important for the countries also to inform the healthcare workers on these initial signals and take all the precautions from the beginning so the patients would be properly alerted, and then eventually also those patients would be allowed to take samples, and the samples to be sent to the laboratories that will confirm or or deny the confirmation of the disease. And it's essential to identify these cases very early, and also to look for the secondary cases and effective management of the current outbreak. So any patient with suspected monkeypox should be investigated. As in other previous outbreaks of the new emergent diseases, sometimes having this type of signals may represent that those persons may be discriminated. Please don't do that. It is on our common community and population benefit to early identify those persons. And if one person has those signals, must look for healthcare. And this must be stopped when it is at the earlier stages. We do not have to let it establish in the country. So this is still a common and shared responsibility, and isolation can occur either in healthcare facilities or at home, provided the infected individual can be isolated and cared for appropriately. So it is also a very important issue. All the countries must be alert. The health facilities must be also planning to have those isolation facilities for the persons who come in, at the same time also to take samples and to for early confirmation of the cases. Thank you so much.
Thank you very much, Dr. Ugarte. We have one more follow-up question on monkeypox, a technical question about the tests from Priyanka Runwal from National Geographic. Priyanka asks, is a two-step process to confirm a monkeypox infection common across countries? In the US, for instance, several laboratories can narrow down to the orthopox virus family, but only the CDC can currently confirm whether the virus is monkeypox specifically. Dr. Vicari, please.
Thank you so much for the question as well. It goes a little bit back to what I already mentioned before about the need of availability of very specific reagent, in particular primers and probe for the PCR methods. So obviously it is more available, readily available, what is really the generic PCR for orthopox viruses, but it's not so available what is a specific PCR for monkeypox virus. And that's essentially the situation. Many countries have the capacity of detecting generic orthopox viruses, but they cannot really do the confirmatory test for monkeypox viruses. So the issue is not so much about training and capacity of the teams, not even of equipment, because the PCR equipment are available pretty throughout the region, but it's really about the availability of specific reagent of probes and primers really to start if you want the testing. And that's essentially the issue in that sense for that specific point. And it's exactly what we are doing in this, as I mentioned before, developing protocols, training the colleagues in the countries, but as well the need of distributing essentially these key reagents in order to really establish what is the specific capacity with PCR methods to detect the monkeypox viruses.
Thank you, Dr. Vicari. We stay with you for two follow-up questions on the flu. The first in English from Ari Daniel, National Public Radio. Ari asks, why are we seeing such a surge in influenza throughout the region?
To a large extent is actually expected. I mean, obviously with what we have gone through the COVID-19 pandemic, there was quite a bit of measure in place that for public health measure and as well so for social distancing, that they have a huge impact as well in the transmission of other respiratory viruses, included the influenza virus. So at the same time, there has been as well the disruption of international travel. And if you want the season in terms of influenza, it really depends on the constant reintroduction of new influenza viruses every season, essentially, that essentially they can as well evade as what is available in terms of immunity throughout the population. So what we are seeing, I will say, is actually in line of what we expected after over a year and a half, where we had basically no transmission or transmissions that were really historically at the bottom, you know, in terms of levels. And it's essentially what we would expect. It will depend and vary really from one place to the other one as well, depending on the seasonal factors that are typical with seasonal influenza in that sense. So overall is something that is expected. I would not qualify it as historically high, absolutely not. I think it is really getting back in line to what we have seen to the constant surveillance by the countries as well, since at least for the last 10 years in that sense. Thank you.
Thank you very much, Dr. Vicari. Masu, una pregunta ahora en español desde México sobre la influenza.
Another question in Spanish from Mexico about influenza from Patricia Rodriguez from Imágenes Mexico. Mexico is noting more cases of flu than those anticipated. Could you specify what is the percentage of increase, and if this increase can be published or could also lead to an increase in COVID-19 transmission? Thank you for that question. Dr. Ugarte has already touched upon this in detail as far as the situation in Mexico, so I don't really want to go into details right now. But let me just point out that the increase in cases, if it exists, is not something that in historical terms is excessive, at least looking at several years. The other point I'd like to make, we're always monitoring the flu circulation based on different indicators, such as influenza type diseases, ambulatory diseases, and also looking at acute respiratory diseases. These are hospitalized cases. Looking at these indicators, in recent weeks, Mexico has actually returned to normal figures. So we can link this to the specific data on our institutional page. And lastly, they point to the fact of work conducted over many years where surveillance for flu and other respiratory viruses, and now COVID-19 has been integrated into these also. So thank you very much. Thank you, Dr. Vicari. We have two questions on a different topic now. The acute severe hepatitis of unknown origin. We have two questions from Mexico. The first, I think it's from Blanca Valadez of Milenio. The question was in the chat. She'd like to know, with regard to acute severe hepatitis in Mexico, are there confirmed cases? How many in the territory? Dr. Espinal, could you answer this question, please? Thank you very much for that excellent question. There are about 650 confirmed cases, not confirmed, probable in the world. They cannot be confirmed because we don't know yet the cause or the etiology. So we have not determined that they are due to hepatitis virus A, B, C, or E, which is what normally and routinely occurs. So we are still continuing with our investigations to determine the cause, and therefore they need to be caused probable cases. There are about 242 probable cases in the Americas, of which Mexico has perhaps 10 probable cases that have been noted. There are probable cases in Argentina, Canada, Brazil, and cases under investigation. For the time being, we do not yet have a cause. We don't know if it's a potential virus. We need to continue gathering data and obtain greater evidence in order to determine the cause of this, and that is why we are calling them probable cases. Thank you, Dr. Espinal. And I think the question was from Melina Ochoa, not Blanca, because I have a follow-up question from Blanca about hepatitis in children. So the follow-up question, we see if it is difficult to reach diagnosis? Perhaps Dr. Vicari can address this question. Thank you very much for this question also. Adding to the explanation provided by Dr. Espinal, we are facing an event right now that's under investigation, and contrary to what we've seen of the monkeypox or COVID-19, in this case, we don't know exactly what we're looking for. So it's important to mention the researchers who are working on this. Let me also mention that we normally, unfortunately, do anticipate seeing acute severe hepatitis in children, and these cannot normally have an explanation because it's difficult to research them fully. Another important fact that I'd like to point out is whether we are seeing these cases more frequently than in normal circumstances. It's not just a matter of searching for something that's under investigation or research, but also see if this kind of acute severe hepatitis in children without clear causes, we need to see if they're occurring more frequently. And the evidence is not conclusive, actually. Although there is data in the UK indicating it could be more frequent, I would say that essentially in other countries, there is no evidence that concurs to a higher incidence of this kind of case. Obviously, any kind of acute severe hepatitis in children can result in transplant and even deaths. These are events that obviously for us are always regrettable and extremely sad. But let us not forget that these cases also occur, and very often without any kind of explanation. Thank you. Thank you, Dr. Vicari. Another question about the hepatitis in children from Monica Garduño from Televisa, Mexico. One hypothesis of the Lancet magazine suggests that the acute severe hepatitis in children could have as a cofactor the existence of COVID-19 in young patients. What do we know about this? Dr. Espinal, please. Thank you, Monica, for that important question. As you clearly say, this is a hypothesis. It has not been proven either positively or negatively. We need more data. The hypothesis is based on a super antigen generated by prior COVID infection. However, despite the fact that COVID cases have been detected in many of these affected children, it's not the majority. So the hypothesis, therefore, doesn't really have solid grounding. Nonetheless, it is part of the research being carried out at the research centers, and we are awaiting the final conclusions of this investigation, of this hypothesis. It is not possible to conclude at this point that it is due to that. We have also spoken about the vaccine hypothesis, but in most of these children under the age of 5, they had actually not been vaccinated against COVID because this is a vaccine that was not originally authorized for that age group. So we need to wait without despair to determine and to wait for the outcome of research. And then appropriate recommendations will be formulated. It's important for countries to continue evaluating cases, reporting them, and preserve lives, prevent deaths, consult with doctors and with families, given changes in skin color or appearance of diarrhea or other symptoms. That is what is important. Those are the recommendations, but research is ongoing. Thank you. Thank you, Dr. Espinal. We're coming to the end of the questions, but let me give the floor to the director now, who would like to talk about the Summit of the Americas that will take place next week in
Thank you very much. And yes, the Summit of the Americas will take place next week in Los Angeles. And this 9th summit, as usual, brings together heads of states and ministers of foreign affairs, ministers from other sectors as necessary, but also importantly, the heads of international organizations that serve this, this hemisphere and civil society and other groups. And this year, the summit will be looking at several agendas, including climate change, building resilience in health and the economy, among others. We see, however, that this is an opportunity for the heads of state to discuss the importance of building resilient health systems as part of health security that can recover the public health gains that we lost because of the COVID-19 pandemic and ensure better pandemic preparedness in the future. But very importantly, the summit is an opportunity to place health at the very center of national rebuilding efforts to strengthen economies, to expand social protection, to increase investments in health, and use innovation to expand health systems and services. So PAHO, we are part of the Inter-American system. We have served as the public health experts for the Organization of American States in their preparation for the summit. And you would know that this summit is being chaired by the United States of America, but it is within the Organization of the American States where the Secretariat there also is engaged very closely with the summit. So yes, I will be in Los Angeles to engage with heads of state and their delegation on a range of public health priorities. And these include the expansion of manufacturing capacity for vaccines, medicines, and other health technologies, rebuilding the health and care workforce, and highlighting the intersections between health and climate change so countries can be better prepared for the inevitable future pandemics. PAHO wants to help ensure that the region of the Americas increases national investments in universal health, public health security, and pandemic preparedness. The Summit of the Americas is a venue in which governments can place health squarely at the center of recovery and building, leaving no one behind. And that's what PAHO has on its mind in terms of our participation. And let me say that there is not a moment to lose. Thank you so much for joining us for this press briefing, and we will see you in the next 2 weeks. I hope that some of you will be able to cover the Summit of the Americas. Thank you for joining us.
Thank you very much, Dr. Etienne, Director, for those final words. A los periodistas y colegas, muchas gracias más una vez por la participación.
Thank you for journalists for your participation. We have come to the end of today's press conference. The next one will take place in 2 weeks, but obviously be alert to whatever notification we may send to you via email. The media team is available to you all for any follow-up question, and you can send this to our email, mediateam@paho.org. And obviously, you will find more information on our webpage. Thank you very much once again for connecting and wishing you a very good week or 2 weeks, and we will see you next time round. Thank you. Bye-bye.